Well, I think that the people on the front lines are just focused on doing their job, regardless of what the president may or may not say. I mean, it certainly doesn't help to hear hear demoralizing words from anyone. But frankly, I think that everyone is focused on doing their jobs. The people in New York, they're getting overwhelmed. People in other cities, healthcare workers in other cities, are seeing what's happening in New York and getting ready for that kind of deluge in their own areas too. And ultimately, we know that this is not just about what's happening right now or in a week or two. This is a marathon, and we are barely on mile one. And we're already out of supplies, and so many people are getting ill. And so we need to prepare for the long haul. And that's what we need for everyone, from the president to just everyone else in the country, to realize and to fully support.
Let me ask you one last question, Dr. Wayne. Do you think in 30 days we'll be ready to lessen our social distancing requirement?
I wish I could say yes, but that's not what the epidemiological modeling would show. Most models would show that to be effective, social distancing should be implemented early, consistently, and done for 8 weeks, maybe more on the order of 10 weeks. And that's assuming that we get everything else in place. We have to get our healthcare system stabilized. We have to have mass testing so that we know what data we're actually collecting. And then we need to see tapering off, not just in one area, but in multiple areas across the country for at least 14 days. At that point, we can talk about backing off our restrictions. But if we back off too soon, then all these sacrifices that people are making now will be in vain.
Dr.